Well, good day and welcome to another version of CityLine in my kitchen. It's going to be a great hour. Later on, we will have the Oasis Youth Center. They have a brand new executive director who I cannot wait to get to know and introduce to you. Matthew Wilson will be here talking with us. And then the Ywca of Pierce County, Miriam Barnett, is back to talk about one of their fundraisers that they are reconnoitering because of the shelter in place and how you can be a part of that. And then we will have the Humane Society. They're here with their Pet of the Week. We love those Pet of the Weeks, and I have to say thank you because they have actually a shortage of pets now because all of you have been so generous in adopting those perfect angels. And then with me now, I have the pleasure of having somebody that I had on a couple of months ago, and it seems like years ago because every day is a new reality. I'm talking about Kimberly Steele Peter. She is with the Tacoma-Pierce County Health Department. Welcome back, Kimberly.
Oh, thank you, Amanda. It is great to see you.
Well, it's great to see you. And I said, you look rested, you look fabulous. And I know you may not feel rested, but you look great for somebody who has been on 24/7 since we first learned about COVID-19.
Thank you.
Welcome, my dear. So I know that there continues to be confusion because there is so much being thrown at us. We all are even more engaged now to the news than we were before. So let's clear up some of that confusion. Would you re-explain to us, like you did last time, so eloquently, why is it called COVID-19?
Absolutely. So COVID is a shortened version. It is coronavirus. So CO is corona, VI is virus, and D is disease, and then -19, it's the year that it was found, 2019. Really quite as simple as that.
Well said, my dear. So let's get right to the point. Are we still seeing the virus in Tacoma and Pierce County? And we know we are, but how does the pandemic look locally?
Absolutely. You're right. We are absolutely still seeing the virus here in Pierce County. We have approximately 1,700 cases in Pierce County so far, and at least 60 deaths from in people who have been diagnosed with COVID-19.
My goodness. So we hear big numbers nationally of the people who have died from it. And I am thinking that maybe we've become numb to this. And I'm going to tell you why I think that. Gosh, the weather's been so beautiful. I see people out, walking outside, exercising. But I also see people in big gatherings and there's not social distancing go on. I see families stepping out of their quarantine circle and inviting distanced family in, and nobody is wearing a mask. So are we becoming numb to it?
I think you're right in that assessment. We are into this a few months now. We are in that time of year, like you said, where we're having beautiful weather. We spend most of our year in rainy, cloudy weather. And this is what we do. We get out and we take advantage of it. So yes, we are, I think, as a community, as a nation, certainly, but experiencing fatigue with how long is this going to go on? And, none of us knows. I mean, we've got the phased approach to relaxing restrictions, but boy, my heart goes out to people, and certainly people who don't have a yard that they can go and relax in and get out of their house. I mean, if they're in an apartment, and we certainly know that there are people who are in apartments or houses with multiple family members. And so again, yeah, my heart goes out to them. And I would say that certainly if you find that you have lapsed in that social distancing, to be kind on yourself, get back on the wagon with the social distancing, because really it's there to help us. It's there to help us as a community and individuals. That the better we can do this now, hopefully we won't see that huge spike in the future.
Well said, my dear. So on the coattails of that, let's talk about, because you work for the authority, what are the symptoms of the virus, and what should we do if we're experiencing those symptoms?
Absolutely. So the symptoms are going to be shortness of breath, coughing, it could be fever. Certainly people have been noticing that they have their sense of taste is altered. It could be anything that's respiratory. Some people are having gastro issues, diarrhea, things like that. So those are the symptoms that you want to keep an eye out for. Of course, most people aren't having any symptoms at all. And some people may have very mild symptoms. But certainly, if you are having any of those, you want to make sure that you are then isolating. If you're going to get tested, talk to your doctor, see if you need to be tested, and then make sure that when you're going in, you are letting them know beforehand, you're masking up so that you're not unintentionally spreading any infection before you find out your results.
Yeah, yeah. Kimberly, I wanted to ask you this also, because I have a lot of homemade masks out there. Can you tell us what's important in terms of covering and what needs to be close and flush?
Absolutely. And I am so glad you brought that up. I was at a store not that long ago and I saw people wearing masks, fabric masks. I wear a fabric mask when I go out, covering here. The nose was left open. I'm like, ooh. So it really needs to be over your nose, over your mouth. People put pieces of like pipe cleaner or a little strip of metal so that you can get nice tight fit in there. So yeah, this area is what you want it to cover.
And I've seen people with this area kind of open and I see the breeze moving. And
yes.
Way in for you to get infected, you need to really just cocoon yourself.
Yeah, no, that's absolutely correct. Yeah.
So I want to talk about, when we talk about how the health department has improved the way that they're sharing data. I saw that on my online news tribune. Tell us more about that, and why did that evolve into a new improved way?
Well, you're right. Absolutely. We have a new dashboard. Makes it easier to see and understand the disease activity. It's by geographic location, and you can go down into the census tract. It goes out and then that detail. We really respond to community requests. And so I want people to know that, so that's where some of this has come from. People wanting to know, what does COVID-19 look like in my community? How is it impacting me? So you're going to see all of this on our website, and we have the current totals for cases, deaths, all of that information is, that's right at the top of the dashboard. And we are doing weekly updates, which include cases and deaths by race, ethnicity, among healthcare workers and in-care facilities. So again, we're really expanding what information we're putting out there for the community, because it's for us, but it's really for the community. We want people to know.
Exactly. Yeah. I mean, I think that, as we talked about the numbing effect, but when you look at it broken down demographically in ages, and then you start to think about who's around you in your neighborhood, who you can be reaching out to, because we've got senior citizens who are off the chart dying of this. I'm just making that up. I don't really know that, just that. I mean, I'm assuming, but that's not a data enforced fact I'm doing, but it does help us become more aware of those who are being hit the hardest.
Absolutely. And I just want to speak to that, talking about the numbing. I think that no matter where you are, whether you're in public health or you're in the community or in media, that when we look at the numbers as a whole, it can be easy to be numbed. But when you look at it or understand how it impacts individuals, when you have a neighbor who is sick with COVID, that becomes much more real and much more personal. Or God forbid you have a family member who has died. Then truly the impact of COVID-19 hits home. And none of us wants to be that person, to have that connection, which is one of the reasons we really have to practice that social distancing. But keep that in mind. If you're somebody who's thinking, well, it doesn't really impact me, it's impacting somebody. It
does. It absolutely does. And as I've said to my mother-in-law, who's 81, if you get this, because sometimes she has a hard time remembering, I have said, if you have to go to the hospital, we can't come visit you. So just think that in mind, trying to remind us to wear a mask and to social distance. Last few minutes here, I want to talk about something that we hear a lot about, and that is contact tracing. So first off, tell us what it is, and then what's the future of it, and will we see it here in Pierce County?
Absolutely. So we are already doing contact tracing. And what that simply is when we talk to somebody who has coronavirus, who has COVID-19, we are talking to them about a variety of things, symptoms, this and that, but also who have they been in close contact with? Now, most of those close contacts, and again, that's somebody that you've been around less than 6 feet for more than at least 10 minutes. Most of those close contacts are going to be your household members. Could be a partner, children, extended family, but it also could be, if you're an essential worker, somebody you work with. It could be somebody you carpool with. There are a lot of different ways that you might have close contact with someone. And so what we do is we find out information about that person, and then we call those close contacts and let them know that they have possibly been exposed to coronavirus and that they need to stay home for 14 days, that they need to quarantine. And when we're talking to the person who has coronavirus, we emphasize that isolation, that they need to stay home now that they know they have it, because often we're the first person telling them that they have the disease, because we are working that fast, that information is turning around so quickly. And it is really important that we get a hold of that person as soon as possible to let them know that they need to isolate at home, and then who they've been in contact with while they were contagious, so that we can get in touch with those people and that they can discontinue going to work or school, and stay home as well for 14 days.
Kimberly, do you anticipate, as we start to move through the different phases that Governor Inslee has outlined, that we will see a surge in contact tracing?
Yes, absolutely. We have staff right now working on developing a plan, training modules, systems, where to house people, or are we going to do it remotely? But absolutely. And that kind of leads to coronavirus, our response to it is just a few months old. We have a brand new program, and we're basing it on our previous experience with diseases like tuberculosis or sexually transmitted diseases. But we have had to hit the ground running and create a program that most other programs have had decades of experience to develop and create and improve. So we are truly hitting the ground running. We're doing it in the spotlight of the public. And yes, we are absolutely going to be, I think we're looking at possibly 100, 150 staff doing this work.
My goodness. But
yes.
I gotta say, I mean, just in this 6 weeks, 8 weeks that we've been in this, which again seems like a lifetime, I have been in awe and amazed at the response of the health department and how quickly you got on board, considering that when we started this, we were in the same category of fear as New York City was. I think that our population as a whole has done pretty well. And can we always do better? Yes, but as you said, be gentle with yourself and get back on the wagon should you have stepped out and just forgot. It's never too late to remember, is it?
It absolutely is not. And we certainly have information. We update our website daily at tpchd.org. And you can also sign up for alerts at that site. And yeah, we're really trying hard to get current, accurate information, reliable information out to people.
Well, you're doing a great job. Kimberly, thank you so much for being with me today. And gosh, I look forward to your updates, and please, you and yours, stay healthy, all right?
And you and yours as well. Thank you, Amanda.